Sikhs from around the world by showcasing their professions, passions, and perspectives. I'm your host, Mandheer Singh, aka the Nihung. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Today, I have Dr. Jaspal Singh stepping into the Nihung's arena. Thank you and welcome.
Thank you for having me.
All right. Before we get into too much, why don't you go ahead and kind of introduce yourself, what you do, and what your expertise is, and maybe what we're going to focus on today.
So first of all, I have to say the opinions today are my own. They're not a part of any other organization. They're not a part of any other employer I work for. So I'm a pulmonologist, critical care and sleep physician. For today's podcast, I'll talk about sleep disorders, which is kind of a passion I've had for a long time to discuss as a former medical director of Carolina Sleep Services and really enjoyed sort of getting into the weeds of sleep disorders, especially for our community. So thank you for having me today, because I think sleep disorders are something that we don't talk about as a community very much.
Well, it's not even that we don't talk about it. We're not even aware.
Yeah.
Honestly, like it's something that kind of hit my radar maybe about a year or so ago, because there's a lot of like these powerlifters and trainers of professional athletes, and they started talking about the importance of sleep and recovery and performance. So that's kind of where it hit my radar, because we'll get into that a little bit later, but it definitely sparked an interest in me. And I started watching a lot of videos and stuff. And so when I decided to start doing this podcast, you were the first person that came to mind, because that's what I had associated with you with. I didn't even know about all the pulmonary stuff, which, by the way, for all of us lay people, that's like to do with lungs and respiratory systems. Or can you please explain that a little bit?
Absolutely. So I also do a lot of work related to advanced diagnostics in lung cancer. So lung cancer awareness, lung cancer disorders, and those things are associated with lung cancer work and diagnostic studies. And some of the technology is kind of my fun hobby is to, some people golf. I play with medical technology a little, and so it's just one of those things I enjoy. Awesome. I also do critical care medicine, and obviously with COVID-19 currently being the pandemic, a lot of my work has been focused in the last 6 months, particularly focusing on the pandemic management.
So that's interesting, actually. You just brought that up. And again, if you feel like we're going off into the weeds somewhere, just bring me back. But with all this COVID stuff going on, how are you practicing? Because I noticed there's a shift towards like telemedicine, doing things over Zoom like we're doing right now, or some other kind of format. But what I can only imagine it's making it easier for everybody to connect and see their doctor. But what are the challenges too that come with? What are the pros and cons of that kind of interaction with patients?
Yeah, there's a lot of pros and cons. Actually, I have a couple of podcasts on that as well. So you're happy to send our listeners the information on that.
Yeah. Send me the links and I'll post it into the description.
Absolutely. So telemedicine, obviously, and especially as it relates to sleep, actually, is really nice because we don't oftentimes want to go see a doctor for some common things. And so telemedicine has really taken off in the pandemic. We've been inching at it for like the last 20 years, but really in the last 6 months, we've done more towards that route than ever.
Right.
So I do a lot of virtual critical cares, as we call it. We basically, in fact, I'm zooming in from my home computer workstation where I can actually monitor critically ill patients from 3 states away.
Oh, wow.
So, and so we have presence across several states in our health system. And so it's kind of cool. I mean, it's kind of amazing what you can do, the high level decision-making you can do. I mean, it's not perfect. You can't do everything. It's missing some of the sort of tactile parts of how we practice. But that being said, with modern diagnostics, communication, team-based care, and boots on the ground that you can trust, you can do a lot of things through this method.
So are you able to like actually monitor people sleeping?
Well, you can.
Remotely?
So in sleep medicine, we've done remote monitoring for decades, actually. We're basically are videoing people in the sleep lab, in a sleep facility. And now with home testing now taking off since the pandemic, it's been taking off for a couple of decades, but really since the pandemic now, most sleep labs sleep testing has shifted to the home. by far away. And so we have home devices, wearables, other devices that have technological monitors. People can sleep in their home and see the quality of the sleep actually to discuss it with their physicians.
So, okay. So you mentioned quality of sleep. How do you define quality of sleep?
Great question. There's probably, to simplify things, I think, for our listeners, I think in the sleep world, we tend to think of sort of two aspects, the quality of sleep and the quantity of sleep. The first one, let's start with the quality. Quality of sleep means we generally have what are called biologically for several decades we've known, sort of for half a century, we've known that our brain goes into a deeper sleep. Sleep is restorative. It's necessary for certain biological functions. You mentioned recovery. You mentioned all kinds of awareness, fatigue issues, psychological factors, cognitive factors that sleep really affects, that proper sleep affects. So you need high quality sleep to do that higher performance. But sleep also, from a quality perspective, people have go into various sleep stages. And there's sort of like two main classifications of sleep stages. To make things simple, one is called REM sleep, or rapid eye movement sleep.
Right.
The second being non-REM, or non-rapid eye movement sleep. And there's several stages of non-rapid eye movement sleep. Most people get about 20 to 25% of rapid eye movement sleep to be restorative. And then roughly, and then a lot of rapid eye movement sleep happens in the latter half of the night, the second half. So you start
is that where we're actually dreaming?
It's associated with dreams, absolutely, and so with the loss of muscle tone and dreams. And so the idea is that you want to achieve a certain percentage of non-rapid eye movement and rapid eye movement sleep, especially the rapid eye movement sleep, which is oftentimes in our society curtailed. Because what happens is we try to shorten our sleep cycle to get our whole checklist done. And so we don't get enough quantity sleep. So we don't get enough rapid eye movement sleep. And so you end up with this sort of, a lot of our people in our society don't sleep long enough. And in return, don't get the high quality that they normally need. They may not sleep through the night. They may not have, they have a lot of awakenings for a lot of reasons, whether it be some of the things that the cycles that they have, the choices, some other issues like anxiety or other concerns that might be waking them up at night. External noises might be waking them up at night, or they may do it to themselves. We oftentimes tend to be our own worst enemy in our society. Not everybody, but some people are trying to really hard to staying up late was considered really cool when I was younger. Kind of, when you and I were younger, it was like our friends would stay up really late and do all this cool stuff. And
we'd be playing video games mostly up until 2 in the morning.
Whatever it was, now I have, a teenage daughter stays up late to study or do other stuff. Another one stays up late for other reasons. And so you start thinking through it. You're like, you watch our society kind of do this to ourselves, and we don't get enough sleep. So what ends up happening is potential adverse health effects. And so loss of quality and quantity of sleep is now scientists are showing that it's not only associated with lesser performance from a psychological factors, cognitive factors, memory issues, but also sort of deeper psychological issues like predilection to, in children, for example, loss of sleep or poor functioning sleep can be associated with ADHD. Can be associated with other behavioral disorders, school learning issues, keeping kids back a little bit and sort of hindering their academic performance. As we get adulthood, things associated with poor work performance, maybe burnout. Maybe some of the burnout that we're seeing is partially at least explained by some of the sleep issues that we're seeing as well. And then other health effects come into that aspect. So not only just sort of mental health disorders like depressive disorders, anxiety disorders, but now you're talking about cardiovascular diseases, immune effects. So we talk about COVID-19 a little bit. A lot of us believe that actually one of the best things you can do to combat COVID-19 and other viruses and is bolster your what's called the innate immune system, your innate ability to fight infections. And so one of the principal parts of that is getting enough rest, enough exercise, eat well, and rest enough. And so you need to sort of pay attention to your body. That's
something that's really ignored, I think, especially like in the media and stuff. They talk about obviously we wear the masks, because we're not just protecting ourselves, we're protecting other people in case we have it, right? But there's a talk about masks and social distancing and things like that. But there's like zero focus on your own immune system.
Correct.
What can you eat? What supplements and vitamins should you take? How much sleep should you be getting? Is your body recuperated and recovered so it's strong enough to be able to fight any possible thing? Because we're seeing such a wide variation of types of symptoms. Some people are completely asymptomatic, and some people are under having very severe symptoms. And what role is that immune system playing in it? And then what role is sleep playing in your immune system?
Right. That's exactly right. And so, and especially now going into flu season with flu season and COVID-19, we're all going to be most likely at some point exposed. So if you're going to be exposed, you want to make sure your body is ready for that. And a lot of us have a very strong immune system if we pay attention to it. So things that we can do to help ourselves, our chances of getting stronger and combating that is, one of the things is getting proper rest. But like you said, exercise, rest, attention to wellness. In the sleep world, one of the things I tell people is if you're using an alarm and hitting that snooze alarm multiple times to wake up, it's probably it's a chance that actually you may not be getting enough sleep. And you need to really look back and say, what can I do to make sure I get enough rest? Am I really getting enough? Or is that just the way I am? Is that just the circumstances I'm in? Is that just something I need to tough through? Or should I potentially maybe do things a little bit different to recognize and perform at a higher level?
Yeah, maybe you can give us some tips on how to get that better sleep. But one thing I've noticed is when I'm working out regularly, I sleep great because my body is literally exhausted and can't wait to get to sleep. When I don't work out, I find that I'm kind of having this light, dreamy sleep all night, and I wake up tired.
Yeah, that's a very common thing that many of us see, and so a lot of us recognize that muscle exertion, muscle fatigue contributes to a deeper level of sleep. And I think especially nowadays, we mentioned the COVID pandemic, what it's done, it also makes a lot of people very sedentary. They don't get out. They don't get around. They don't even, some people are even nervous to be
guilty.
In the neighborhood.
That's me. Big time. I'm at my computer all day or I'm driving in my truck, literally not moving nearly as much as I used to.
Right. And so one of the adverse effects of that is we're seeing, the people with this feeling less tired, even though they're not exerting themselves. They're feeling more tired. They're not exerting themselves. And part of that we think is just lack of combination of things, not just the social engagement, the stimulation we get from that, but also the lack of muscle usage.
Right. And it's a use it or lose it type of thing. And then you're not expending that energy. So now your body is kind of buzzing. I don't know how to put it. Like I'm mentally at the end of the day, I'm exhausted. I lay down, but I'm finding that my body's not quite ready to sleep. It wants to do something. Yeah.
So you mentioned sort of like what are some take-home points of people can do to kind of sleep better. I think if you're really interested in the space, I think that the term that we use is called sleep hygiene. So if you want to sort of look at the best practices of sleep hygiene, there's a number of resources available on the internet. An American Academy of Sleep Medicine has really nice patient information sheets related to that. So does the American Thoracic Society and other societies they all have this. But essentially, what you want to do is get a routine. Number one, you want to start to pay attention to your routine, pay attention to your body, which means that basically if you're sleepy, really trying to adjust your schedule that you can pay attention to when your body's most fatigued. Minimize caffeine. We don't realize it actually, but caffeine, as we get older, people tell me all the time, they're like, I can drink a coffee and go to sleep, or I can drink a tea and go to sleep, and I don't have a problem. You're a doc. You're not really.
I say that kind of thing all the time.
People tell me that all the time, and I used to be in denial as myself. But we don't realize caffeine is a drug. So when we were younger, like any other drug, we just like whether it be food or anything else like that, our metabolism drops, and it does for caffeine as well. So when we were younger, the half-life of caffeine. So if you drank a nice big mug of chai or a big Starbucks coffee or something like that, or an energy drink of some sort, half that caffeine would still be there about 3 hours later. So what happens is we talk, and so when you get older, though, that half-life extends.
Wow, wait a minute. Hang on. 3 hours later, that's about the time you might be eating a snack or another meal. You could easily go from having like a soda or something with your lunch, and 3 hours later, drinking another soda or a coffee or something, and it's still in your system. It
stacks, right? So if you stack it where you're drinking several caffeinated beverages a day, the caffeine dose tends to stack a little bit. And as we get older, though, what happens is our metabolism starts to drop. So you and I are past our 40s. So after we get 30s to 40s, our metabolism starts to really drop. We notice it when we eat even a little bit more than we used to, we gain more weight. And so we notice that it gets harder to lose weight. It gets harder to metabolize medicines. Caffeine, same thing. So what happens on my older patients, as they get older, about 40s, 50s, 60s and beyond, what happens is they can fall asleep because their body is so sleep deprived at the time it goes to sleep. But what happens is that caffeine's still there 3 or 4 hours later. So as their sleep deprivation starts to be resolved by sleeping, what happens is their caffeine that's still hanging around says, hey, I'm going to wake you up. I'm going to make you actually wake up a little bit earlier. You may not sleep as restfully. And I notice it myself now that I pay more attention. If I drink a caffeinated beverage after 4 or 5 p.m., I used to be able to drink, several caffeinated beverages a day without a problem and sleep well. But now when I do it, I actually realize that, I don't sleep as well at 3 or 4 in the morning. I'm waking up, tossing and turning, restless, may get up to urinate more often, with something that we don't talk about in our society. We don't talk about urination at night because it's embarrassing. But it's a common concern.
You know what? You mentioned this urination at night. I actually read something recently that said that one of the reasons you might be getting up to go to the bathroom at night, we always think, prostate, things like this, weak bladder or something. But I read that there's also something about with sleep apnea that when your oxygen is getting cut off, your brain sends a signal for you to pee so that your body will wake up and start breathing again.
Well, that's one explanation. So sleep apnea, let's kind of shift to sleep apnea.
Yeah, sure.
The other thing we talk about, so let me step back. So let's step back about the sleep hygiene. So we talked about making a schedule, making a routine. The other thing we talk about caffeine minimization. And the fourth thing I want to say is get your brain to wind down. And oftentimes we don't. We end up sort of checking our phones or our messages and everything, and computers on, TVs on, other stimulation going on right until we go to sleep. And we actually recommend for people, some people can do okay with that, but many cannot. Many end up sort of like, having a little bit of downtime. And you really want to make sure that your bedroom is sort of like, you have some downtime to relax, downtime to make your brain wind down. In the Sikh religion, we oftentimes do part. I think our Guru Sahibs wanted us to actually wind our brain down and think of the last thing that we want to do is to swela part. We kind of think about, what good thoughts we can have, appreciate our inner selves, the beauty of the world when we go to sleep. And so there's a certain psychology behind some of this work.
Now, is there an amount of time that's necessary to wind down? Like, is there a minimum, like 30 minutes, 1 hour, something like that, or just different for everybody?
It's different for most people, but for those people who have an issue getting their brain wind, some people have a harder time with it than others. For those who have a hard time falling asleep, we recommend give about a half hour to an hour to wind your brain down, which means no devices, no emails, no text messaging, no checking your social media, like up until the late.
We're all guilty of that. I know.
Right. And so paying attention to your schedule. And so these are all part of what we call, and then of course, minimizing caffeine and all those things that we just mentioned can really help facilitate what we call sleep hygiene. The exercise you mentioned, that's part of sleep hygiene. It's sort of getting your mind focusing on sleep quantity and quality. Now, so if we pay attention to those things, we can talk more about that if we need to. But the next step comes to sleep disorders. And one of the things that our culture does not do a great job in discussing, because we oftentimes think this is just something that, there's a lot of misperceptions. So one of the most common things that I see is misperception of a very common sleep disorder that affects a lot of people. And that's called obstructive sleep apnea. And it's a very common disorder. It's something that gets a lot of negative press, negative public perception, but it's extremely helpful to know if you have that or at risk for having it. Sleep. Well,
wait, real quick before you continue with that. Part of the problem, though, from what I've understood, is that like if you go get a sleep study done, your insurance goes crazy. Your health insurance goes crazy and says, oh my God, this guy needed a sleep study. And now he's at risk for diabetes and heart disease and all this kind of stuff. And your rates are going to go up. Is there any truth to that? Or is this just kind of like the, urban legend type stuff, urban myths about?
I can't speak for anyone outside my area in North Carolina. Because I have not heard that as a real concern. I don't know if other parts of the country that's a concern or not. Honestly, I don't really see it. What we oftentimes see is the opposite, is that people who that have the symptoms don't pay attention to it suffer consequences if they don't get it treated. And that to me is a bigger risk if you're an employer, if you're if you're someone, a health insurer, when you're not treating something that's very easily treatable, not making an effort, you may have more further consequences.
Okay. Good
so
point.
Obstructive sleep apnea is basically, imagine, we talk about the deeper levels of sleep, the steeper stages.
Yeah.
Imagine, you will, like when we were younger, the back of our throat was nice and stiff, like other tissues were. But as we get older, imagine the flab in our arms or other tissues, things get softer.
Hey, there's no flab here.
Yep.
It's all down here.
so we end up, so the tissues get floppier, so do the ones in the back of our throat. And as we go into deeper and deeper levels of sleep, particularly as we talked about rapid eye movement sleep, the deeper REM sleep, the tissues get really floppy. And so there gets to a point where in some people, as they're breathing, the outside air, the air gets blocked up here or doesn't flow fast enough to get into your lungs.
Now, that's not necessarily related to being overweight or overly developed in your neck. You're talking about the actual tissue inside has softened.
The tissue inside has softened. Now, there are factors that are contributing to that. Well, if you're overweight, if you have a thicker neck, if you have certain people just have a genetic predisposition. It's a family history there, potentially. They may have to do with the shape of their mouth and the shape of their jaw.
Interesting. I have lots of questions about that too coming up. So, because I read something about that too.
Yeah,
go ahead.
The shape of their jaw. Like, for example, I have some patients from Southeast Asia, like Chinese, Taiwanese descent, who are extremely skinny. People think it's just for overweight, but people from there have a horrible sleep apnea because their jaws may be certainly designed a certain way where they get more likely to predispose to closure.
Very interesting.
So the bottom line is, if you have this issue, what happens? Well, what happens is your brain goes into a deeper and deeper levels of sleep, and then your airflow drops, and your brain says, wait a second, Mandheer. It might be, I'm just making you up, but whatever it is, wait a second, I can't have you do that. So brain wakes you up, sends an arousal signal to your body, and it wakes up the brain. It wakes up the parts of the rest of the body. And in fact, we can actually check what's called sympathetic tone in your blood vessels. The sympathetic system is activated. It's not normal for it to want to be that activated. And a couple of times a night, if you have mild obstructive sleep apnea, with this happening a couple times an hour, it's not terribly concerning. But when you start getting to 5, 10, 15, I had a patient last week, over 80 times an hour was this happening to him.
Wow.
And on top of that, oxygen levels dropped tremendously. If you have long enough closure, your oxygen levels can drop at night, all night. And this has been going on for months to years. And over time, the cumulative effects of all that can potentially cause not just problems with thinking, breathing, it can cause problems with cardiovascular risks, diabetes risks. And if I told you that if you had severe obstructive sleep apnea, let's just talk about the severe cases for now, which is common enough. If you have severe obstructive sleep apnea, if I told you that, the treatment is not a pill, it's not surgery, and it's just air pressure, you'd be like, that doesn't sound so bad.
Right.
And so the most common treatment is a heated, humidified air pressure delivered through a system called positive airway pressure, or CPAP. You may have heard that term.
Yeah.
Continuous positive airway pressure. And there's different masks. CPAP is just basically a little bit of next to your bed, it's a little bit of a little device that puts heated, humidified air either through the nose or through a special mask through the mouth, depending on your facial structure and your personal preference. And as your airway starts to close, it actually kind of stents it open. It's
just through the pressure of the air.
It's not surgery, and the air pressure is customized, the mask is customized. And my patients who have severe obstructive sleep apnea, when they're treated, they oftentimes notice a significant benefit.
Now, you mentioned oxygen levels. What is a normal oxygen level to have while you're sleeping? And then what levels can it drop to that makes it so dangerous?
Yeah, for most people, a normal oxygen level is above 90%, whether you're awake or asleep. 90% of your oxygen molecules are oxygenated. Your hemoglobin molecules are oxygenated. But at night, it's not uncommon for it to drop a little bit. If you have lung problems or neuromuscular problems, certainly that may drop it further. But if we start getting less than 85% consistently, we get nervous. We worry about that association with other diseases and why that's happening. So we start to get nervous about that. And so we actually monitor that in a sleep study, for example.
Yeah. So I am familiar with the CPAP machines. Now, I'm going to maybe ask you some questions here and get your genuine reaction, okay? Because I did not do a sleep study or go to a doctor or do anything like that. I actually got a Dream Station CPAP machine off of Craigslist. Mm-hmm. Somebody who had prescription for it, they got a new one that they didn't need. So they were selling it brand new in the box and everything. I got that, and I got a mask that goes over my nose and my mouth. Mm-hmm. And I have some questions about how to fit it properly, with a beard. But I didn't really get it for sleep apnea. I thought maybe I had sleep apnea, but it was more for, like I was talking about, the performance aspect, trying to get better sleep through the night. And it did take me a couple of days to get used to the mask. But it's automatic. Everything's automatic on it. And it's got data that downloads to my phone. And I was able to, after about a week, I was able to sleep through the night, and man, it made such a difference. I mean, I actually was sleeping. Mm-hmm. Like I felt when I woke up, I was wide awake. And then I started getting curious, like, okay, so do I have sleep apnea or not? And actually I have some of here, let me see if I can bring this up here. Yeah. This is the most exciting part of the podcast, when I'm quietly searching for stuff on my phone. Yeah, let me see. So it's cool because you can kind of see some of the things, but I don't know what they mean. Like I don't necessarily know what all these things mean, like it AHI.
Right.
AHI details. I have
yep.
Total clear airway apnea 0, total obstructive apneas 1, and total hypopneas. How do you pronounce it?
Hypopneas.
Hypopneas 35 and then I got 6 hours of usage that night. And let me see what it says. I don't know if any of this stuff is going to make any sense. Obviously it's going to make sense to you. It doesn't make sense to me. But like 90% pressure was 7.9 cmH2O.
Yeah.
Average CPAP pressure was 5.9. The minimum pressure was 4. Maximum was 20. Yeah, I mean.
Right. So what you're describing is, I would encourage you to actually, just for your own sort of knowledge, as you're quite knowledgeable about this, for your own sort of mental sake and better understand why you're benefiting from this, I would encourage you to do at least a home sleep apnea test.
Okay.
Just obtain one or get one done by your physician. Because actually, I think you'll better understand whether it's the sleep apnea, where were you when you started? Because a lot of us try to understand where our patients are, what are the indications, do they really need it? So most of us, the guidelines currently suggest getting a sleep study first as a first step.
Okay.
You're describing, though, however, a lot of us feel that, why does CPAP pressure, which is not a pill, it's not surgery, it's just an air pressure, why does it need a prescription? Why can't we just buy it over the counter with our own stuff off the shelf?
Yeah, I mean, I definitely wondered that, and I'm sure there's a good reason. I'm just a stubborn idiot.
Well, I'm probably the skeptic in me thinks there's a financial reason. There's a market there.
Right. That's what I was thinking, but okay.
There are some countries that actually do it that way. And there are some people who believe that that's how CPAP should be prescribed, because one of the things we've created now by making this specialized sort of field and stuff is we've created this public misperception that sleep apnea is a disorder. That really has a negative connotation, that wearing a CPAP is a pariah of some sort. I have a lot of younger patients who feel that, or they may not be married, they may be in unstable relationships, they may feel like, they don't want, it interferes with bed partner intimacy.
Right.
They don't want to have to take that with them. They don't want to have to travel with it. And so they have a lot of misperceptions here. And so we've done is, I think, created this sense that it's not a thing that can become easily treated. So what you've done is actually what a lot of us actually kind of want to happen, which is basically like, hey, I'm not feeling so great. I need to improve myself. And so let me just kind of pay attention to this part. Now, I would encourage you to just answer answer the first part of the equation is, do I have obstructive sleep apnea?
Okay.
Probably do. The question is how severe. And I think a lot of us like to know that ahead of time. Because if it's only mild, we don't get terribly excited about CPAP therapy, a lot of us. But when it gets severe cases, we try to understand the severity. And that severity is defined by how many times an hour this is happening, or by how low the oxygen levels get and how consistently low they get. That defines our severity. And then treating it can be extremely helpful. And so what happens instead in our culture, and I'll tell you, I went to a wedding one year and they made us roommate with other people for this wedding party, which is nice to control costs, but oh my God. And this person snored so loudly, and I mentioned
the room with a sleep doctor.
And I wasn't a sleep doctor at that time. And I was, oh my God. And and so he mentioned something in conversation, like, hey, you notice that? Oh yeah, everybody jokes about it. My snoring is not a big deal. This is a big joke to the family. And you're like, now that I understand more, I'm like, gosh, like your risk is actually really high of health problems. Well, you should get this taken care of when you're younger, so we can actually improve your lifestyle overall and your overall health profile.
Yeah. I mean, when you even think about that one night of snoring for him disrupted your sleep, right?
Oh, it was horrible.
It's disrupting his every single day ever since and before.
And that's true. And so, we had to drive hours to get there. And then he drove there too. And I thought he had to drive back. And I'm like, you know what? The one thing obstructive sleep apnea untreated is associated with is motor vehicle accidents. 7 to 12 times higher risk of motor vehicle accidents. So when we think about sick truck drivers, what I mean? How many of them actually probably possibly have obstructive sleep apnea that aren't being treated, and they're putting a risk to themselves and to the public?
Wow.
And so
I've never thought about that.
And so, you have to think about our community a little bit and think about what is our responsibility to our larger public, our greater public. And so I really think we should really pay attention to it and not make this sort of a joke, but actually be like, you know what, let's pay attention to this. So that our quality of sleep at night can be better. So what you had done on that machine is telling you that your AHI, your number of times you stop breathing at night, is actually less than 5 times an hour, which is above 5 is when we start thinking about obstructive sleep apnea. But this machine actually has a way to sense how much airflow you're obstructing, and you're actually treated for it. Right? Is the before part.
Sorry. Yeah. No, what I noticed too is, just to destigmatize all of this, my initial ideas of what happens with a CPAP and what actually happens changed. Because when I first put it on, I felt like, oh my God, this thing it's not a ventilator, right? It's not forcing you to breathe. Right. It took a minute for me to realize it's enhancing my own breathing pattern. As soon as I start to inhale, it senses I'm inhaling and it pushes the air through. Right. And when I start to exhale, just naturally, it senses and it lets off. So the initial reaction is it starts to pump air and you're like, you want to like fight it. And then you feel like there's something on your face and you're suffocating. But if you just take a minute and just relax your brain for a second, just start to breathe normal, the machine is actually enhancing your normal breathing rather than pushing how you should breathe. And I don't know if that's true for people with actual sleep apnea, but that's what I noticed when I'm using this machine on this automatic setting.
Yeah, so what you're experiencing is very common, and it's a very common initial sort of what we term the honeymoon period of CPAP therapy. Is like it takes a little bit getting used to understanding your bed partner and understand how their patterns affect and how you're going to interact with your bed partner. Yeah, totally get it. Now, I will say though, your experience was a good one. I have a lot of patients that like, you know what, this is not natural. This is a machine. And you imagine now, let's talk about risk factors for obstructive sleep apnea for a second. What is one of the biggest risk factors? Postmenopausal status in women. So postmenopausal women, you can imagine the aunties that you know putting a CPAP on. Right away, they're like, no, it's not a problem. It's a joke. This is ridiculous. We don't do this in our culture. And you think of how much undiagnosed obstructive sleep apnea there is in our community. And you start wondering about that. And I wonder about that all the time. I wonder how many people we're missing on this and maybe a harbinger of significant problems underneath. And we've actually, this idea of this public perception that this is not natural, that this is not how we should do. I don't want anything on my face. I don't want anything to do with this. And not the willingness to kind of work with this bed partner, the way that you describe, is something that I think is a barrier.
I read this book. When I say I read books, I mean I listen to them on Audible. Okay, so let me just clarify that. But there's a book that I listened to called Breath by James Nestor. And he talks about how the human jaw has evolved and how when they look at old dental records of even like Neanderthals and early humans, their lower jaw was more forward and they had more room in their mouth, and they would sleep. You could tell they would sleep with their mouth closed. I don't know how they did all this analysis, but they were able to figure this kind of stuff out, and their teeth were straight. And one of the things he describes is that we stopped breathing from our nose, which is the natural way that we're supposed to breathe. And he talks about the sinus cavities, how you absorb 20% more oxygen going through your sinus cavities than you do going through your mouth, the same breath, right? So then you can actually breathe less per minute and get same amount of oxygen, so he goes through all this kind of science explaining it. And he talks about that over time, our jaws have kind of gone back and our teeth have crowded in our mouth. And that's actually affecting the way we breathe and the way we sleep. And for people that think, oh, this machine, it's unnatural. No, what's unnatural is the way we've started sleeping because of the various factors, the diet, the weight gain, and even maybe some of the things you haven't really mentioned this yet, but your mattress and your pillow and how you're positioning your neck or whatever in your head. Those things are more the unnatural side of it. And these machines are kind of helping us go back to more of a natural breathing pattern, to the point where like I've tried taping. I don't know if you do that with any of your patients, but I've tried taping. I find it to be a little freaky. Like you freak out a little bit like, oh my God, I got to open my mouth. But once I get used to it, and I don't do it consistently, but once I get used to it, usually it takes me a night or two, I do really well. I've noticed my mouth doesn't dry out. I feel like I've been breathing better all night. And I've tried to combine it, the taping with the mask, and I feel like it's really good once I get used to it. But the getting used to it part is different because I've done so many years of the way I am. And I'm guessing a lot of people are like that.
Yeah, I think it's just, you bring up a lot of complex topics, the idea of jaw structure, the idea that some people believe that palatal expansion of the mouth, for example, especially in the pediatric population, is a way to treat sleep apnea. People now are doing surgeries now that are just a recent trial came out with expansion of the back of the throat. That there's a crowding in the back of the throat. Part of that is we just, the hard thing is hard to know which factors are going to be an issue when, and which factors treating them is going to make a huge difference. I have patients that have gone through CPAP. Many do well, but some don't. Some have gone through surgery. Some go without treatment and change their diet, exercise, and we kind of follow them over time to see. And right now, they're still trying to learn as to which patients are going to benefit from which treatment the most. There's not a one-size-fits-all.
Okay, and then I know, like you mentioned surgeries. One thing that I think is common is people get like a deviated septum fixed, and that supposedly is going to help them breathe better and help them sleep better. I mean, but I don't really know, not necessarily, right?
Not necessarily. It depends a lot on the anatomy of the person and the individual. It may help your snoring, but then the sinus septum here will not stop the blockage in the back of the throat. So it kind of depends on a lot of issues here. And so I think there's a lot of misperceptions. And so I do encourage people, if they have obstructive sleep apnea, and especially if it gets severe, first of all, get tested for it. I mean, many people can do testing now in the home. You don't have to go to sleep. It's not going to be necessarily that your doctor's going to send you to a sleep lab to spend the night. You may be able to get it very easily at the home, which is really which is very helpful for a lot of my patients to understand that. Number two,
and it keeps the privacy too, and people that are going to,
and then number two is talk to your doctor. And if you don't trust your doctor to do this, then find a specialist. And nowadays with telemedicine, you can find a sleep specialist anywhere on the country. So it's kind of cool. Even in pediatrics now, where we had a hard time getting a hold of sleep specialists, we have pediatricians pediatric sleep specialists that can be that you can make appointments through telemedicine, virtual visits as well. And so we can kind of figure that piece out for your kids and everybody else.
So that's the first step. You got to get this done. get the sleep study done so that you can find out how many obstructions you're having and whether it's non-existent, mild, or severe.
Right. I think understanding that part of your biology will be very helpful. And sometimes a single night may not do it. May need a couple of nights to kind of figure things out. But with a home test, it can really help a lot.
Yeah.
That's the first thing. And then the second thing I would do is if you're not sure or your doctor's not sure what to do, just kind of figure out, start taking a diary of what you've noticed. Ask others around you how you're sleeping. Ask others if you have that ability, if you're not alone, if you're asleep with other people. Pay attention to your symptoms. How tired are you? What time of day? So if you ever download what's called a sleep diary, we oftentimes have our patients do a sleep diary. When are they taking caffeine? When are they taking their medicines? What time are they taking? They're just going to bed? What time they're winding down? And start paying attention to this. There may be a pattern that you're not seeing. The other thing is start realizing what might be keeping you awake, whether it's be how many times a night you're waking up to urinate. Maybe that, you know what, you have a symptom where your legs are creeping and crawling called restless leg syndrome, where you may be having a completely different disorder. And if you're a premenopausal woman, that may be tied to heavy periods. Again, something we don't talk very much about, the idea of iron deficiency and other biological factors contributing to your sleep, that treating the iron deficiency may help you sleep better. And so these are all kind of things to consider, that it's not so straightforward that, you know what, I did a couple of things wrong, I fixed a couple of things, not a big deal, or, you know, Uncle so-and-so, he snores, let's ignore it, let's put it aside, it's just a family joke. Let's take it seriously. And let's try to convince that person to get tested.
I think your point about logging is really important because back in the day when I used to kind of help train some of my buddies, like, you know, they would say, put a workout schedule together, put a meal plan together for me. What do I need to do? You know, and I enjoyed that kind of stuff. So I would say, first things first, we're not going to do anything until I have 1 week of you just writing down everything you eat. Don't change anything. Don't try to eat healthy. Don't try to eliminate. Just write down everything you are currently doing. If you have a Snickers bar in the middle of the afternoon, you go to the vending machine and grab a Snickers bar. Just write it down. We're not judging it. I just need a log of exactly what you're doing. And the most important part of that was, as you're writing things down, your brain goes, I didn't really need to eat that, but I had to write it down. Right? There's a certain kind of weird self-accountability that happens. And then you start to change. Then next week, when I say, okay, we're going to cut out that Snickers bar in the afternoon, it's easy to do because they already hate writing it down. Yeah. Right. And so if you're writing, and it's same thing with finances, they say that all the time, write down where every penny goes, and all of a sudden you're going to start saving money because you're going to hate writing down money wasted. Right. And it's the same thing here. If we treat sleep the same way we treat, you know, our health or our finances, and because sleep is part of your health. If you treat it the same way and you're writing down this log of what's keeping me awake, how did I feel last night? How did I sleep? How do I feel in the morning now that I woke up? If you're writing all this stuff down, you're going to start to notice yourself what some of the factors are. Yeah, I was on Facebook on my phone until 11 last night, you know, and your brain is automatically going to tell you, subconsciously, it's going to say, I hate writing that down. It's embarrassing writing that down. So I'm going to stop doing that. Not stop writing it down, stop doing it so that you don't have to write it down.
Yeah. And our point isn't to like obsess about your health, because most people really don't want to obsess about their health. I think if they're realizing that, you know, one of two things. One, there's a problem. You're falling asleep while you're talking. I mean, I have patients that will fall asleep while just, you know, talking mid-sentence. I have patients that have almost had several near motor vehicle accidents, near crashes, or a crash that brought them into the doctor's office. That's like the worst. You know, God forbid somebody else gets hurt besides yourself, especially. I've had patients that, you know, over the years that, you know, have suffered heart attacks for unknown reasons. And you look back and you're like, wow, they had horrible sleep apnea that was never diagnosed or treated. And those are things that you think about, you know, like you look about and you're like, okay, that's an issue. The other part of it is fundamentally what you're getting at is what you're kind of working on, from what I hear you talking about, is you're trying to constantly find a way to be a better version of yourself.
Yeah. Yeah.
You know, and so fundamentally that's with our guru's principles, you know, the idea of it's a journey, and it's part of that journey is to recognize, you know, how you can be a better version. We're all in different parts of that journey. at any given moment.
Yeah.
And I have plenty of my own flaws, which we're not going to get into because of podcast.
Come on, we could get into one or two.
For the podcast. But I have plenty of flaws, and I might say this stuff, but I have plenty of times I violated my own sort of advice, and so, but the idea of, all of us kind of trying to be better, and it's not necessarily one big thing. It's like little things that we can do potentially, that little adjustments that we can make to recognize that we can be better at what we do, accomplish our goals, accomplish the goals we have for ourselves, our family members have for us, or whatever our circumstances in life might be. And so attention to good sleep practices, attention to, it's not just sleep practices, but also, do you have a sleep disorder, or does somebody have a sleep disorder, and getting the proper attention that they can be the better version of themselves and fulfill their needs and goals is important too.
Yeah. Okay. So I do have another question that I want to get into, but before I do, I kind of want you to finish the track of, some of the things that you can do in order to prepare for a better sleep.
So a couple things, cool the room down. Oftentimes I know we want to I know there's certain climate or electric bills or other issues, or depending on where you live, about the generally speaking, the cooler the room, we tend to sleep a little bit better, more soundly.
Okay. Interesting.
And so that's one thing. I think oftentimes we don't recognize that. Darkness is our friend when it comes to sleep. So the darker, the better. It just helps our brain to cool down. I think for people who have a hard time shutting their mind down, they may need professional coaching. I think some people some of the hardest people I have to train are the super successful professionals. Their minds are always going. Yeah. They're constantly going. They're like, okay. And then what happens is they wake themselves up in 2 in the morning. For many of us, I wake up 2 in the morning, I come back to sleep. Of course, may not be as successful, but the bottom line is,
I think you're promptly successful. Come on.
I'll go back to sleep and I'll be like, not thinking much about it. But I have some colleagues who are like, once 2 in the morning comes, we actually have a term the technical term is called psychophysiological insomnia. The colloquial term is clock watcher. What happens is, and you can see it happening, a professional who wants to has a high performing individual will look at the clock and say, 2 o'clock. Oh, gosh darn it. Now, if I don't get to sleep now, then tomorrow I have a 7 o'clock. Then I have an 8 o'clock this. I have a 9 o'clock this. I'm not going to be tired by 2 o'clock. And then they start becoming their own worst enemy. Their mind takes off to a new level.
That is definitely me. I do that a lot. I'm looking at the clock going, if I don't go to sleep now, I'm not going to wake up in time, and I'm going to be tired from my workout. If I'm tired from my workout, I'm not going to be good at my job. Definitely I'm doing that. So if clock watcher was the layman's term, what was the actual term that you used?
Psychophysiological insomnia. That basically you're psyching yourself out, and that's resulting in a physiological disruption.
Wow.
That your heart rate gets going, your body gets going, and pretty soon the insomnia starts to kick in because now you can't sleep for a while. And so that kind of gets you going. And so I think for that, actually, the most time-tested, proven therapy is sometimes includes professional coaching, what we call a cognitive behavioral therapist, or a cognitive behavioral therapy for insomnia. The term is CBTI, but it's actually a form, and there's a bunch of people out there that do this. Many of them now via Zoom. You can get a coach like you can for tabla practice. Like my son takes tabla practice virtually, and you can get a coach that can help sort of calm you down. There's apps that can help calm you down, like the Calm app, for example, might be an app that you might want to sort of think about. For some people, it's Kirtan. I think Kirtan is a very good, depending on how you react to it, can be a very good way to soothe the mind, calm the body, and make you keep perspective.
Yeah, we actually have a Sonos system in our house, so we actually play Kirtan very, very lightly at night. And my wife picks all the files, because she's constantly listening to it. And then I do find that to be very soothing. But I'm actually really good about getting to sleep. Like if I lay down at like 9:30 or 10 o'clock, I'll just go right to sleep. My problem is if I don't go to sleep at that time and I'm looking at the clock and I'm like, oh my God, it's 10:30. Oh my God, it's 11 o'clock. Or if I wake up at like 3 o'clock in the morning and I'm not falling asleep, I keep looking at the clock going, oh my God, I've only got 3 more hours of sleep. I need to get all 3 hours. Right. And I start to obsess about that.
Right. And you're not alone. A lot of people have that issue. And so it's just one of those things where or they might have it at different times, or a certain stressor kind of brings it on. Like, something in life may have happened, or something you're worried about, whether it be financial or social, or,
right.
Recent family event that kind of gets things going. And so that's not an uncommon situation.
So now you mentioned keeping the temperature in the room cooler. Mm-hmm. Then you had earlier mentioned something about pillows and mattresses. What advice do you have about pillows and mattress?
So there's not really a lot of data about the pillows and mattresses. The companies will tell you that, oh yeah, so-and-so company is better than others. Sure. But really it's the one that you I encourage people to try things out. To actually, I know we don't like to spend money. I know we don't like to sort of have extra waste, but sometimes actually going to a store and actually trying things out while you're there, just, go to a mattress store, don't be afraid to actually line the mattress, and right. check it out, check the positioning out. And then at the next day, if you've end up buying it, often these companies have a return policy or something like a certain short-term warranty. Don't be afraid to use that. Like, no, this didn't suit us. Don't think that the most expensive mattress either will necessarily be the solution for you. You shouldn't have to break the bank to get a decent mattress to actually meet your needs. Now, whether they meet your needs and your partner's needs, there's companies there that'll help to sort of, if you have a bed partner to accommodate, who may have a very different comfort level, you may want to sort of negotiate something there and kind of figuring out a happy medium.
Yeah, and then they have like those sleep number beds too, where the different sides of the bed can be different firmnesses and things like that too.
There's all kinds of
gimmicks out there. Yeah,
gimmicks, gadgets. Some people swear by them. I don't have a sleep number bed, so I don't know for sure whether that's any better.
You want to know something hilarious? We bought this years ago. Yeah. Okay, so I don't want everybody getting mad at me, but we have a Trump mattress. It's how he was selling all the ties and everything.
What say about that
one? he sells everything, right? And he put his name on mattresses too. And when we went to the store, we tried out all these mattresses. We're like, oh, this is our best one. It's a good mattress. I won't deny it, but it's not like he made it. He just put his name on it. But yeah, it bugs my wife. She's like, I want to get rid of this.
That's so weird. Yeah, I don't know how well I'd sleep on that. But regardless, I think it's important to actually pay attention to your mattress. Get a comfortable pillow. There's one pillow that we have that I realized that was a pretty bad investment expense. And so I'm trying to find a way to unload it somewhere. And if I put it in a guest bedroom or something, my wife won't notice. But it's all kind of it kind of depends on how your neck positioning is, how your body is. People have different spines, different structures. And
it's not necessarily that you might just, because you know what, I've noticed that I have a tendency to get two pillows and kind of put my arm underneath, because I feel like it keeps my neck kind of straight. But you're saying that's okay. Just kind of figure out what's comfortable. It's not necessarily like a certain shape of a pillow or a certain density of pillow is the perfect pillow. Everybody's going to be different.
Correct. That's as far as we know right now. There's not a lot of scientific data here. So most of us are telling our patients, go ahead and find what works for you.
Okay. All right. Very good. All right. So I do have another kind of Sikh related question when it comes to sleep, because again, a lot of what I've read, some of it is reading on the internet. I just want to be clear. I don't want anybody, don't take advice from me. I'm an idiot. Okay. I read stuff on Google and I listen to audiobooks. Okay. But I read that meditation can also have a lot of the benefits of sleep. And, in Sikhi, obviously, we have this concept of meditating on Waheguru or doing Simran or doing Path, where you have this single focused attention on something. Can you speak on that a little bit? What do you know about meditation and effects on sleep, or maybe its similarity to sleep?
It's a great question. I would say meditation is a lot of data to support meditation as a very good practice for restoration and focus. It has some compelling data for its neuropsychiatric effects.
Okay.
Now, do I think it substitutes for sleep? I think most of us would be leery about making that it substitutes, because I think sleep as a distinct biological entity, meditation is still, if I understand meditation the way you're understanding it, I think your meditation is still mentally awake. You're mentally focused, if not hyper aware, depending on how well you meditate, which I'm not even close to there. So,
right.
But that being said, I don't know if that's really sleep. And so in terms of a brain activity, biological phenomenon, what I tend to notice in our community is there is a very strong aptitude to meditate and pray, oftentimes at a sacrifice of enough sleep.
Interesting.
And I worry about that a little bit. I'm not saying that I'm not, any kind of spiritually enlightened being by any stretch of the imagination. But that
none of us are. I mean, come on, we're all guessing, right? We're all trying to figure it out.
We're all trying to figure it out, but I do see that a lot. I see what? Guess what? I remember we'll have people that say, let's do part at 4 a.m. Let's do, a nice, really good kirtan program at 4 a.m.
Like
4 a.m. They're awake all day, and then by the afternoon they're falling asleep on the couch, passed out where they are, not able to have a conversation when everyone's over. And you're like, wait a second, there's something. Then they don't even go take a nap. Just go take a nap. Go rest. You don't have to be go all the time, and then squeeze in a meditation and a part or something else like that and to fight that sleep. I think you deny your body and your mind and potentially your soul a chance to really recognize its true inner self.
Interesting. That's an interesting point. I mean, maybe going back to your earlier point too, that thought before you sleep or meditation early in the morning, once you wake up, once you had nice restorative sleep, the thought at night can help you kind of decompress and get ready to sleep. And in the morning, meditation practices, doing Simran, doing Bhat, can actually slowly waken you up without all the other distractions, without all the other go. And as long as you've had good sleep, you can actually maybe focus more, right?
Potentially. I mean, I have a routine. I think all of us have different routines, but I like to, when I wake up, actually, some people like to shower. I like to first slowly wake up, do some quiet part to myself, and make my coffee. I have a good. I don't use an alarm. I just wake up, unless I'm working the night shift, which is a whole different issue. Not working the night shift, I'm good, and then I can actually take care of things and get going in the morning. I feel really just at my peak after that morning coffee, after the morning meditation, after the morning sort of routine, and I usually work out at that hour.
Yeah.
It's usually, and then if I get that workout in, then I shower, I feel like my day is ready to go.
Right. I
feel
absolutely
really in tune with what's around me. If I break from that routine, my kids will tell you, Dad is not exactly. They notice the weaknesses. The weaknesses come glaring. My character flaws come out shining.
Yeah. No, I know the feeling exactly. Especially with the whole that routine. I'm the same way. I don't need an alarm to wake up. I wake up pretty much 5:45-ish every day. And if I follow my routine, I'm getting my workout in, I'm getting ready, I'm eating a healthy breakfast. And then I'm starting my day, getting on my computer, checking my email. If I follow that routine, I'm good. But if I, let's say I missed the workout, which, this whole COVID thing, I thought I'd be working out all the time at home. I got my gym here, kind of didn't have it. It almost went the opposite. But if I don't do that now all day, I'm thinking I still got to get my workout in. And then you don't get it sometimes. Then you miss it. And then it's the end of the day. And now you don't feel good that you missed your workout. And then your next day can be off, So that routine is key. And for me, it starts with getting to bed on time so that I wake up at 5:45 refreshed and awake.
I agree with you. Not everybody's a morning person either. So recognizing people have different circadian rhythms.
Sometimes you're not a morning person all the time. I never was.
Right.
I was never a morning person. I would stay up late and everything and then wake up later or whatever. But in my recent years, I've kind of shifted. And I think I shifted once I started paying attention to it. And then it became kind of important to me. But like you said, our community doesn't think about it. And there is kind of this negative idea about any kind of problems you're having. It means somehow you've been irresponsible with your health. And nobody wants to admit that.
Well, you bring up a very good point, Mandheer. I think one thing you bring up is, we tend to assume that the late riser is a lazy person. There's a couple of factors here, right? One is sort of this, we've romanticized the 4 a.m. Amrit Vela thing a little bit. I mean, for many of us, for me, it works. It doesn't work for everybody. For some people, actually, it's actually a hindrance to their benefit, to them. Yeah. So don't get me wrong. I think Amrit Vela is awesome for me. For those people, there's early morning people. But for those who aren't early morning people, actually, trying to align with that actually potentially could be hurtful. The other part of it we realize is that culturally, I think many of us come from an immigrant culture where working hard, working all the time, being an immigrant, that's how the way to live. And then we're surprised by this burnout pandemic, and then you're like, and then you're starting to think through all those factors, and you realize that if you go now in the sleep literature, now we're seeing more and more of what's called a circadian rhythm misalignment. The idea that certain people biologically function at different hours and have a different natural alignment with sunlight. And I think not paying attention to our circadian rhythm can be potential, or the circadian rhythm of others is important. So you've seen the recent public controversy related to school starting later in the day. Yeah. Part of that's based on some sleep science, actually. And actually, I applaud our sleep community from actually being vocal about embracing this later school awakenings now.
Yeah, no, I'm all for that too. I'm all for it.
And then also the idea of we've sometimes shunned naps, but in fact, short naps can be quite restorative.
Yeah, especially if you feel like you need one.
Right.
If you're feeling like you need one, you don't take one. It's again, like you said, you're going for that burnout, and you're not making a better living. You're actually dying. You're killing yourself doing that.
You just have to be very aware, and I think I'm becoming better now in my late 40s. Now more aware than I wish I was more aware when I was in my 20s of what I should have been doing.
Yeah, if only you knew then what you know now, right?
I know. And but that being said, I think there's something that I really want our community to pay attention to is recognizing, our own selves and the patterns of others around us. Because I think we tend to jump to judgment, to jump to conclusion, think a one size fits all is the way it needs to be, and realize that there's actually room for a lot of diversity in the space of how people sleep, what they're doing, and how people function.
Yeah. Yeah. I was just sitting here thinking as you were talking, my mind drifted a little bit. I was trying to figure out, when did we meet? Because I feel like I've known you a long time, but I don't think I've ever had a chance to really have an in-depth conversation on something like this with you. I mean, I can't remember if we met at a retreat or did we meet after you got married? I couldn't
retreat, and then kind of over the years, some casual sort of.
Yeah, like here and there running into each other.
And then and it was kind of, I think we connected at one of the retreats recently with our kids being at the retreat, and you gave a nice talk about, about Guru Amar Das.
Oh, right. Yeah. At the camp. We were at camp. Yeah.
At the camp. And I thought, okay, kindred spirit. That's when I started realizing that, I think we could probably connect on other levels.
Yeah, no, absolutely. We definitely should be hanging out more. I'm surprised we don't. I mean, I know why. Actually, I don't go anywhere. I don't travel.
Life and geography.
Yeah, and we're in Michigan, you're in North Carolina, but we come down there because just his whole family is there, right? So we come down there at least once a year, sometimes twice. But we were actually just there this summer because my niece, Kirit Kaur, got married, and they did a really small, socially distant kind of wedding. It was kind of neat how they did it because they had little stations set up for each family with their own microphones.
Oh, nice.
So you just did kirtan from your little family station, so you didn't have to go intermingle. But the wedding was really nice. It went well. But we just did that trip, and then we kind of haven't really done anything else. But next time for sure, we'll make a point to meet. You guys are in Charlotte though, right?
Correct.
Yeah. We can make a point to get together. That'd be really good. Listen, we've done over an hour here.
Thanks for having me.
Thank you so much for coming on. I really learned a lot here, and I'm hoping that my listeners will get a chance to get exposed to you and a lot of the work you do, and then also just the idea of taking care of better sleep. And if you think you might have sleep apnea, or if you think you might have any sleep issues, like you said, you can do these home studies now, these home tests, and it's worth talking to your doctor about and figuring it out because it is as critical as any other part of our health. we worry about our workouts. We worry about our eating. We don't think about sleep, and we really need to start focusing on sleep a little bit more.
Yeah, I think especially, one thing we didn't touch on was, our population is at risk for certain diseases, higher than potentially the average American population. And so you start thinking
like diabetes and heart disease,
cardiovascular diseases. Correct. Yeah. I mean, fortunately, we don't smoke. Generally speaking, smoking is not a big problem in our community, but alcoholism is. You start thinking about mental health issues, and you start thinking about, how sleep affects all those aspects. I mean, it's definitely little things can actually add up to make a significant impact in your life in attention to all those other disorders.
Yeah. No, thank you so much. I really appreciate a lot of eye-opening stuff here, and I really hope people can benefit from it. Do you have anything like you can promote, like your Twitter or something that people can kind of go check out? Yeah,
sure, absolutely. And then maybe we'll kind of get together and do some telemedicine discussions. Sound good?
No, that would be awesome. Come back anytime. Actually, anytime you want to talk about all the things that you might be an expert in, or just want to just talk. It's okay, because this podcast is very casual.
All right. Sounds good, Mandheer.
All right. Thank you. Waheguru Ji ka Khalsa, Waheguru Ji ki Fateh.